need was and why we're here.
And also, I would love to hear from you guys, if you have patients that come in that are blood avoidant, what you know about the program, what you don't know about the program, and certainly what unmet needs might be out there from an educational standpoint so that we can address those. So what is blood avoidance? Blood avoidance is the use of evidence-based medical and surgical techniques aimed at conserving the patient's own blood. So we have always at Northern Westchester Hospital taken care of patients, respecting their wishes, giving them the care that is culturally appropriate to their needs. And we avoid transfusions as best practice anyway. But there are certain populations that will refuse blood transfusions or certain blood products no matter what. And we wanted to have a formalized program around that special population so that we can provide the best care possible, evidence-based, make sure our staff were educated and comfortable, and make sure that we have resources out in the community to help guide us so that we can best take care of those patients. So the purpose of the program is really to support our mission, which is providing quality patient-centered care. The blood avoidance program just was a natural evolution of already taking excellent care of patients, but knowing that some patients may choose to go to other hospitals because they have a real blood avoidance program, and we don't want any patient to choose to go somewhere else. Number one, especially if they're in our area, and we want people to come to us because frankly we're a better hospital, we're a nicer hospital. We take excellent care of patients, we have excellent outcomes, our patient satisfaction scores are top of the nation, so why would anybody choose to go anywhere else? And if you look at hospitals with bloodless programs, I know that the map is a little difficult to see. You can see we're in a really important area of need for patients who do not want to accept blood and want to receive care. So who is interested in blood avoidance? We learned a lot. Our steering committee, we put together a steering committee a couple of years ago, headed by Dr. Kabi, orthopedic surgeon, who does a lot of work up at Putnam, which has a well-respected blood avoidance program. And Joel Seligman, we actually went down with Dr. White, Seligman, Dr. Kabi, we went down to Englewood Hospital, which is internationally recognized as having a blood avoidance program for the past 20-something years. We learned so much from them. I always thought Jehovah's Witnesses didn't accept blood, but they were really the only ones. But there's not. There's a lot of people that will not accept blood. We learned some Muslims, some Orthodox Jews, even vegans would see blood as being an animal byproduct that they don't want to accept. Healthcare workers, when people actually understand the risks that come, the evidence-based risks that come with mortality with getting a blood transfusion, many opt to not receive a blood transfusion, and they're looking for hospitals to educate them and physicians prior to even coming into the hospital on how to optimize themselves to avoid the need for any kind of blood. Anyone has the right to refuse blood. So our goal is to identify patients early, if we can. Certainly mother-baby, we've had a number of patients that have been, we found out at 20 weeks or even earlier that they absolutely will refuse blood, and we've had that time to be able to work with them to make sure that everything is seamless and that we take excellent care of them as we always do. So I would love to just introduce, we have some very special guests with us today. We're lucky that we have two very special guests with us today. We're very lucky to have hospital liaison committee members. These are people in the Jehovah's Witness community that are actually assigned, partner with hospitals to help when there is a Jehovah's Witness patient who comes in, that we can reach out to them. They may call us in advance and say somebody's on their way. And I would love for Roger Klingerman and Rob Rodish to be able to speak a little bit about the community, maybe speak a little bit about their wishes and where it comes from, and really just be a friendly face so that you know who you can reach out to if you need to, and really just to answer your questions. So can I throw it over to you and have you speak a little bit more? Some people ask why do Jehovah's Witnesses not want to accept blood? And that's a question that Stacy Reeder, our blood avoidance coordinator that we had, spent a lot of time speaking about the reasons for that. So can I just introduce the group to you and have you speak a little bit?
You know, the major reason is basically scriptures out of the Bible. Both the Hebrew and the Christian scriptures indicate that blood is sacred in God's eyes. So we believe strongly that we try to help our patients. And actually, when patients come into your hospital with Jehovah's Witnesses, it's non-negotiable. They will not take blood. Now, years ago, I've been around this area for a long time, unfortunately, because I'm old. But when I was here years ago, 34 years ago, we had some trouble in this hospital because they really didn't understand what we believed, and they did their best to try to force blood on us. So we did a lot of transferring of patients. We transferred a lot out of here. Over the last 10 or 15 years, though, things have really changed dramatically. I think your new management is outstanding. We've had the privilege of we started making presentations here in the hospital starting like 2000, when Gino Bettino was one of your doctors that was really pushing for a blood transfusion program with blood avoidance. And we got to know him very well. We made a presentation to his group in 04, but nothing happened until about 015. And around 015, we started to be invited back again. We made presentations to committees, to pastoral care, to the nurses. So we got to know the hospital a lot better and let them know why we don't take blood. And it's very serious to Jehovah's Witnesses. I mean, to us, we don't want to violate God's law, and we feel strongly that it's really emphasized in the Bible, we exchange for blood. Now, that gets into a question of what is blood. Well, in 49 CE, when the apostles and elder men met in Jerusalem, blood to them was a container that was red. And that's all they thought blood was.
That's the same as wine, though, right?
I'm sorry?
That's the same as wine. Right?
Yeah, that's
Is it
right.
wine?
But, you know, as time went on, we started breaking it out into composed component parts. So we believe strongly that whole blood is absolutely non-negotiable, and the major component parts, the four, the red white cells, the platelets, and the plasma, we do not take that under any circumstances. But what the governing body in 49 CE didn't realize was that technology has moved forward. Now we have fractionalization of the various blood components. The question becomes, what do Jehovah's Witnesses believe as far as fractions? That becomes a conscious decision on the part of our friends. The Bible doesn't speak about fractions. So there's no answer for that. So the point is, the major items we do not accept under any circumstance, and then with our conscious decisions, some will do it, take a fraction, and some won't. Now, some will reason that blood is blood, we're not going to take any component part. But we want them to be well informed, because through the fetus and the mother, there is a transfer of fractions between them in a natural setting. So some may say, well, if it's natural setting and God allowed it, we feel that we can do that. But it's a conscious decision. Bob's going to talk a little bit about our healthcare proxy. Everything is defined there. We say what we accept, what we refuse. It's very clear. So when our friends come into the hospital, generally speaking, you're going to know they're a witness. You're going to have all the information. You're going to check their documents and take it from there. I will say this, I'm really surprised in my experience that you're this far advanced in blood avoidance. When we gave the presentation in 2017 to Dr. Cobby and the group that was representing him at that time, it didn't appear to me that you had much going there. And every now and then when I see Dr. Cobby, I'd ask, were we advancing or making any progress? And he'd say, yeah. I came in today and I found out you have all kinds of avoidance programs going on. So it's commendable on your part to do that. So you got a good reason why we don't do it, and when I say it's non-negotiable, I really say that. We just don't. So we in the hospital liaison committee, this came about what, 20, 25 years ago, when we formed this committee all around the world. There's over 1,700, I think, all around the world. All the major metropolitan cities in the United States has what we call a hospital liaison committee. And our idea is that we're the liaison between the patient and the medical community so that we can avoid controversy. Over the years, we've had a lot of controversy, as I mentioned earlier. Today, it's a little bit different. It's not quite as dramatic as that. But we still occasionally get points where doctors will insist that they have to take blood or they can't operate. And we understand that. And we say, please, if you feel that way, tell us. I mean, we had a case a couple of years ago where a doctor was really adamant about he couldn't perform the operation if the person didn't take blood. And he and I talked about it. It was a Friday night, and he said, I can't come in tomorrow if I'm called in on an emergency and treat this patient without blood. And I said, we really appreciated that. We're going to have to transfer him out. And he said to me, please transfer him because I can't handle this. And we've had a couple of cases like that. But we work very closely. Our protocol with you, your protocol to us is review all the alternatives to blood management, particularly non-blood medical management. Review that, contact us, that is hospital liaison committee. We will contact consulting doctors. We have a case going on right now where a sister needs to have a liver transplant. Bloodless liver transplants are difficult. We know of 3 places in the country where they do that: Los Angeles, Memphis, and Michigan. So we are in a position when she qualifies for a liver that we can send her to any one of those places to have it done bloodless. We know they do it. Many around here do it, for instance, the medical center, but they don't do it bloodless. And that's very important to us. So we monitor that very closely. And we will transfer patients, as I said, where we think it's necessary. And many times the hospitals want us to do that. So that gives you kind of a scope of what we do. In our program, we calculate, our organization has a database. We monitor all the publications that come out. We know what non-blood medical management we can offer. We have clinical strategies for various specialties that we give to the surgeons in those departments that might help them. We have doctors that are on basis for consultation, like the ones I mentioned, those 3 liver transplant situations. Those doctors are there to consult with the doctors here. So we have a whole program that we have a lot of things that we do. So we're there to provide comfort to our patients, anything that we can offer to the medical community about data, articles we know that might be helpful, and that's basically what we do. You can add the rest.
I didn't know that. Just real briefly, is education and communication are a big part when very often it's here, oh, they won't take blood, and that just like closes doors. The answer is no. That's only very specifically, as we said, with the blood itself. From there on out, there's a lot of yeses, and we want to have that communication between the doctor and the patient and the staff there. So we also spend a lot of time with our members by educating them. So we have not only things and publications for the medical community, we have our members go through this, and they go through and they have a legally binding form, state-specific in this country, country-specific worldwide, where they've actually gone and researched, well, what is the biblical stand, and then what are some of these other things that the medical community has? Can I use the sealants? What about vaccines? What if I'm pregnant and I have an RH, right? What do we do with these things so that they can come to you, hopefully, having filled some of this in, so they have a basis for the conversation, and they're as far as we can get them as an educated patient before they come here on anything elective, right? And then they can provide this, and that gives a basis for being able to have the rest of the conversation. And as Roger commented, we do have groups that literally scan all documents year-round, all the time looking, so that we can provide to the doctors all the most current and updated strategies can be used in a difficult situation. And they're doing wonderful things. We have bone marrow transplants that are doing this now, double lung heart transplants with these things. It's phenomenal, the progress they've made, and the good results, as you mentioned before, in the community, faster recovery, less contaminated, right? This is available, it's online, we can provide it here, and as Roger said, if it is a difficult situation, the cell number of doctors around the world, 24/7, that said, yes, I'll be a consultant physician, peer-to-peer, so the doctors can talk, you know, your language directly with someone who's done this procedure numbers and hundreds of times, maybe thousands of times, successfully, so that you now have that approach to it and you can have that raised comfort level.
Thank you. So when we started this program a couple of years ago, we wanted to start small. We said for education purposes and really identifying a process flow. It's a really good thing I'm loud. Gotta be louder now. We decided to start with orthopedic surgery. We said, let's take, Dr. Kavi is kind of a resident expert. He can help lead this with us. Let's start with this. Let's develop a process flow with the physicians, with anesthesia, and then roll it out that way. That alone took about 6 to 9 months with the steering committee meeting, working with Northwell on developing a policy, which we actually were the leaders in. The policy, if you read our blood avoidant policy, it really was written by us, the Northwell policy, as well as the consent form. We were moving faster than all the other Northwell hospitals, so they looked to us to lead steering committees within the Northwell community. We had a blood avoidant coordinator, Stacy Reeder, who was an existing RN here at the Northern Westchester Hospital, also one of Jehovah's Witnesses, so she was a wonderful resource for us for multiple reasons. And what we found is that even though we started with orthopedic surgery and kind of perfected and fine-tuned this process, we were having patients come in saying, I heard you have a program, I want to be part of the program, and we had to roll it out. I mean, if we have a program, we have a program. So we found that we had anticipated we would have about 18 patients a year be enrolled in our blood avoidant program. And when we started this in 2016, I believe it was 2016, we had 80 patients in that year that were part of the blood avoidant program. And so we really had to educate, go to floors and do a lot of work. And we realized that we still have a lot of work to do, which is why we're doing this ongoing education. We do have a steering committee that meets, and we do have, I know the physicians, the anesthesiologists are on board, and our pre-op team has done a fabulous job because they